Friends, did you know that if you're planning to get pregnant, it's highly advisable that you start taking folic acid way before, even conceive? Did you know that pregnancy is supposed to last 40 weeks? So a normal one is supposed to last up to 40 weeks. Did you also know that the baby's heartbeat, the fetus in the womb, their heart starts to beat at the 6th week? Did you know that babies or kids that are born before the 37 weeks of pregnancy, they are called preterms? Did you also know that you can find out the sex of your baby by the 20th week of pregnancy, usually when you go for the scan? Did you know that omega-3 fatty acid, DHA, plays a critical role in the healthy growth and functional development of the brain and eyes of these babies? Omega-3 fatty acids equally play a critical role in enabling that you give birth to babies with the right weight and also sustaining the entire pregnancy. Well, if you do not know, this video is for you. Hello friends, my name is Joseph. It's a chilly Saturday evening here at Masapharm, and it's always a pleasure to come into your space and share knowledge with you. Well, today I would like to share with you something on pregnancy. I want to highlight what happens during pregnancy, both to the baby inside the womb, the one that we call the fetus, and then also to the mother. We shall also appreciate that during the different stages of pregnancy, the body demands for certain nutrients, and it's critical that a mother is supplemented. We shall also appreciate the different brands of these supplements that we have on market, but most importantly, the ones that we have also at Masapharm Pharmacy. Now, pregnancy, all of us are products of pregnancy, all of us. Unless maybe with the advent of technology, there are ways when you can have this done in a lab. To begin with, every lady who is planning to get pregnant should supplement with folic acid. Usually we prefer 400 micrograms done daily, and they should continue even when they get pregnant for the following 12 weeks. That is a must. Folic acid is needed because it helps to prevent giving birth to babies with defects, especially on the brain and then also the spinal cord. Matter of fact, mothers who do not supplement babies with folic acid may end up giving birth to babies with a condition that we call spina bifida. If you do not know, you can always find out. Not good. The baby does not look with such a condition. So, upon meeting someone, a male of your choice, you have intercourse, a man is supposed to release the sperm. This sperm moves, and if you're in your fertile window, it meets the egg. When the egg meets the sperm, it gets fertilized to form what we call a zygote. This zygote moves through the fallopian tubes to reach the uterus. The uterus is the home where growth of this fertilized egg takes place. So upon reaching the uterus, it implants onto the inside lining of the uterus. And then thereafter, an embryo starts to grow. Pregnancy starts only when implantation has taken place. That clearly means that you can actually have a fertilized egg, but pregnancy does not take place. There are conditions under which a lady can have their egg fertilized by a sperm, a viable sperm, but then they never get pregnant. It is at this point that you may have to go and check with your preferred gynecologist. Why is this happening to me? So when fertilization has taken place, implantation has taken place, pregnancy starts. Now pregnancy lasts 40 weeks on average. Obviously, there are those that give birth. There are ladies that give birth before the 40 weeks. There are also those that give birth relatively after 40 weeks. Now, those that give birth below the 37th week, such babies are called preterms. Now, the entire pregnancy is divided into 3 trimesters, each trimester lasting on average 13 weeks. So we have the first trimester. In the first trimester, this is when organs of the baby are being formed, a process that we call organogenesis. The brain, the heart, the lung, and others, they are formed during this stage. It is at this stage that we do not want mothers to really pile their bodies with so many drugs. Why? Some of these can actually harm the baby. Just to highlight one, vitamin A. Vitamin A is not needed during pregnancy. It predisposes the fetus to having birth defects. Then we also have cases when during this first trimester, on the side of the mother, there's an increase in the levels of hormones, both estrogen and progesterone. Because of this, they tend to have changes in their mood that we call mood swings. They also become fatigued. This is due to the increased utilization of the nutrients. So they become relatively weak somehow. They tend to lose appetite. they have what we call morning sickness, which is coupled with nausea and vomiting. Then after the first trimester, you move to the second trimester. And this one usually runs from the 13th week up to the 28th week. It is during the second trimester that you go for the scan. In fact, by the 20th week, a lady can identify the sex of their babies. So those of you that usually plan these baby showers, you can actually find out the sex of the baby by the 20th week. Now, during this second trimester, the organs grow in size, and it's on the side of the mother that you see the belly grow in size. Because of that, sometimes it compresses on the bladder, so a lady tends to urinate quite a lot. It is during the second trimester that we call the honeymoon stage. Why? Those disturbing effects of pregnancy, the likes of morning sickness, mood swings, they subside during the second trimester. So we progress, the baby is growing, and then you go to the third trimester, which starts from the 20th up to when you give birth, usually 40th. So by 32nd week, actually the bones are fully formed, though they are still soft. The eyes can open and close. Then also the mother, on the side of the mother, they start having back pain, they start having leg pains, they start having, there are those who actually experience swellings of the ankles, swellings of the feet, even swellings of the face. It can happen during the third trimester. Now, there are instances when a mother can give birth even before the actual normal date, either 39th week or 40th week. And in such a case, when a mother gives birth before the 37th week, the baby is called a preterm. It's not good to have preterms. Why? Usually preterms have health challenges to do with breathing, to do with development. There are developmental delays. They are predisposed to having what called cerebral palsy, which is not good. Yeah, so babies born before 37th week, these are called preterms. There are these that are born on the 37th week and 38th week. These are called early terms. The early terms equally have some health challenges. But statistically, babies that are born in term, when I say term, these are babies born within the 39th week and 40th week. These ones have better health outcomes as compared to babies born before the 38th week. Now, the mothers equally need these supplements. So I'm going to highlight the supplements that we need during the different stages of pregnancy. Like as I said, folic acid is critical throughout the entire first trimester. But then also vitamin D is needed in the first trimester. Why? It's important for the development or for the calcium utilization to enhance bone, muscle, and teeth development. We also need inositol. Inositol helps on hormones, but also it's important. Inositol is important for the development of the brain and the spinal cord. When you move to the second trimester, we have the likes of DHA. This is omega-3 fatty acids. Comes into play. Very, very critical. Needed for the healthy growth and functional development of the brain and the eyes. DHA omega-3 fatty acids. It's equally very important in enabling that the mother gives birth to babies with good weight. It also sustains the pregnancy. We also need the likes of magnesium. Actually, during the second trimester, mothers, some of them tend to experience muscle cramps. So magnesium comes in handy. We also need vitamin D3, like as I say, needed for utilization of calcium. We also need vitamin C. Vitamin C improves on the absorption of iron. We also need the iron itself. Iron is needed for blood formation. Mercury, during pregnancy, the woman's or the lady's blood increases in volume by close to 50%. And this can risk her to getting anemia. So iron comes in handy to mitigate that so that the ladies do not experience anemia. A lady with anemia will see her, she's pale, she's weak. Even breathing becomes a challenge when she moves just like a small distance. They are dizzy. So iron is important throughout the second trimester, throughout the third trimester, even after giving birth for the body's full recovery. So when you move to the third trimester, the nutrients that are used in the second trimester, they are the same that are also needed in the third trimester. This is when calcification of the bones is taking place. Having said that, I would like to share with you some of the common brands that we have on the Ugandan market that contain those that I've mentioned, or if not all of them. And I'll start with this. It's called Preg Plus. These are tablets. Preg Plus, it contains omega-3. This is DHA, omega-3 fatty acids. But then it also contains vitamin C, which I said improves on the absorption of iron. It also contains iron itself. Iron is needed for blood formation. It also contains vitamin D. Vitamin D is needed for calcium utilization, among other supplements. Remember, do not use vitamin A in pregnancy. It brings about defects on the baby. We also have this, it's called DENK. DENK, meaning it comes from Germany. DENK prenatal plus DHA. It also contains DHA, which is good for the brain and then also eye health of the babies. It also has iron, which I mentioned. It has folic acid. It also has vitamin C, which improves on the absorption of iron. This one does not have vitamin D. We also have this, it's called Mama Preg, from the name Mama. So if you're planning to be a mama, you can use Mama Preg. It contains folic acid, vitamin D, but it also has a magnesium. Remember, magnesium improves on muscle relaxation. Those that experience muscle cramps, magnesium comes in handy. It also has folic acid, like as I said, vitamin D, but this one does not have DHA. Yeah. Then we also have Pregnaplan Strength. Pregnaplan Strength, it has omega-3 with DHA. It has folic acid. It has vitamin D. So these are critical throughout pregnancy. These are common brands. You could have had them, or maybe a friend uses one of them. Pregnacare. Pregnacare has different forms. There's what called Pregnacare Original, needed throughout pregnancy. It will supply you with vitamin D, which is needed. You need 10 micrograms of 100 IUs. It also has vitamin C. It has folic acid. It has iron, magnesium. These are really important, even as selenium, which helps to boost a mom's immunity. You take one per day. A pack has 30. It's a full month supply. We also have this called Pregnacare Conception. This is unique. You need it when you're trying to get pregnant. It supplies you with folic acid. It also supplies you with inositol. Inositol helps to balance the lady's hormones. So you take this when you're trying to get pregnant. So this is also a full month's supply. Then uniquely, we also have Pregnacare Max. Pregnacare Max, as the name suggests, Max, it has those added benefits. And this one has omega-3, important for brain and eye health. It has folic acid. It has calcium, vitamin D. It has zinc. It has magnesium, selenium. It's actually a full package in one. This one is unique. Why? You take 3 per day. So you take 1 capsule and then 2 tablets per day. A pack has 84. It is a supply for 28 days, roughly a month. By the way, there are ladies who raise a common challenge of swallowing tablets. We have a solution for that. Pregnacare Gummies. It's on market, available at Masapharm. Pregnacare Gummies, a tin has 60, and we recommend you chew 2 gummies per day. It's a supply for a full month. Very palatable, easy to take, convenient. This is for you. So, to just summarize what I've shared with you, I want to say this. Did you know that a lady who is planning to get pregnant, we recommend that you start supplementing with folic acid. 400 micrograms taken daily. Even after getting pregnant, you continue doing that for the next 12 weeks. 2, a baby's heartbeat starts by the 6th week. So you can know that you have a live baby when you go to the Musawa, and then they are able to know that by the 6th week. Equally true, by the 20th week, you can identify the sex of your baby so that you can plan ahead. Those who do shopping, you shop while you know that you're shopping for the sex of the baby. Mothers who give birth before 37th week, those babies are called preterms. Did you know that? Also, omega-3 DHA fatty acids is critically important for the healthy growth and functional development of the brain and eyes. Omega-3 fatty acids are needed to have normal birth weights of babies, but then also sustaining the pregnancy. Yeah, so thank you for listening. I hope to see you in the next one. Feel free to share your ideas, and I hope to listen and learn from you as well. Peace. I wish you the best.